healthcare systems are constantly changing. There's no question. Performance is constantly improving. I'm very convinced of that, and this comes from my experience in working in various countries and looking at the performance of the healthcare system in various Canadian provinces and Australian states. So of course, it is good news to see that systems are constantly adapting to changing needs of the population, integrating new technologies, new therapeutic procedures in healthcare systems, but it is of course a challenge for management and clinicians to respond to this on a constant basis. I think that it's very important to pay attention to the measurement, not just of the goals achieved through that constant transformation that help us to understand if the changes are having positive results for patients, but also pay attention to the data with regards to how things are organized, really trying to better understand this complexity of the healthcare system and its delivery. It is complex with regards to the number of providers that are involved. It is complex with regards to the increasingly complex pathways of patients and trajectories within the hospital sector, but also with other sectors. And if we don't pay attention to really understand those flows, really understand the dynamics of human resources, delivery of services, we're constantly reactive to those changes instead of trying to be a bit more proactive and understand where is this all going in terms of human resource management, in terms of new technologies, in terms of changing patients' needs. And it is a daunting task to stay abreast of so much information constantly changing. But it's extremely important to base the decision on an understanding of what's happening and looking on a regular basis on those trends. Sometimes it means that we need timely information on a daily basis, but sometimes it just means that we need to do a yearly assessment or a quarterly assessment of how things are going. And my advice would be to really try to understand what's the information that I need on a daily basis and pay attention to that, but what's the information that I really just need to look at on a less frequent basis in a more planning perspective, more than a managerial perspective. And this information is increasingly available. Organizations like BHI, but also the Agency for Clinical Innovation and the Clinical Excellence Commission are designing new tools for managers to access those different types of information given the different decisions that they have to make. But I want to again acknowledge that it is a constant challenge to stay abreast of such an amount of information in a context where everything is changing, but it's really worth the try and a rewarding, in the end, exercise to be able to be more proactive about those important decisions.